Hello, everyone. I'm Dr. Daniel Cameron. This is the Common Sense Lyme disease case discussion. Can you imagine a 3-week-old who's had an engorged tick bite, had a Lyme disease rash, got treated for Lyme disease, and within 2 hours had a Herxheimer reaction? By looking at this case, we can get to understand Lyme in newborns, and the Herxheimer reaction. I'm going to be discussing the case, but get ready for the Q&A session afterwards. So welcome, everybody. Let's begin. Now, I'm a doctor who's also an epidemiologist and an evidence-based author, and so I'm going to be discussing this, the case that I published in my Lyme disease science series. But this is not intended to replace a doctor making a clinical judgment based on your presentation. Now, this was a 21-year-old newborn who presented with decreased activity, poor feeding, and abdominal distension. Now, these are symptoms that children might have anyway, but it just happened to follow an engorged tick from the infant's forearm 5 days earlier, followed by an erythema migrans rash. Now, an engorged tick means it's been there long enough that it's more likely that it will pass a tick-borne illness. The presumptive diagnosis was early disseminated Lyme. Intravenous ceftriaxone made sense because you would have a difficult time with oral medication and certainly with pills at that age. But within 2 hours, the child developed fever, tachycardia, and a Herxheimer reaction, sometimes just called Herxheimer reaction or JHR, and the symptoms gradually resolved with treatment progression. Now, the Lyme test was negative, but this case made it in the literature and published in the literature, which allows us to discuss this case. Now, this particular Herxheimer reaction is considered a transient clinical phenomena in spirochetal infections. It was first described in syphilis. Also, it's been described in leptospirosis, relapsing fever, and Lyme disease. It's characterized by a sudden worsening of symptoms. Now, they're not completely sure what causes the Herxheimer reaction, but initial theories were endotoxins, but lately they've been thinking that due to the rapid killing of spirochetes, there's a release of bacterial components which triggered cytokines, tumor necrosis factors, and interleukins, and lead to a cascade of symptoms. What this case from the literature reminds us that JHR or Herxheimer reactions occur in neonates, which is important because we're often not paying attention to a child and thinking that a Herxheimer reaction, we would just blame it on something else. It shows that a Herxheimer reaction followed by treatment is worth investigation. And this case, it shows a child that can have disseminated Lyme disease. Children themselves have early Lyme and late Lyme, but it shows that in newborn 3 weeks old, you can have a Lyme disease presentation. Also, if one looks at Herxheimer reactions, this particular author describes symptoms that aren't always apparent in a newborn, like fever, arthralgias, myalgias, chills, hypotension, tachycardia, non-pruritic, non-palpable rash, nausea, headaches. Once again, we're going through this presentation live, so I can present this case and present a little more information how I look at these cases in my own practice. I'm Dr. Cameron, and get ready for a Q&A shortly. This case by Prodnuk and colleagues show that early recognition and treatment of Lyme disease in newborns is possible, that one should at least anticipate and manage Herxheimer reaction if it occurs, and this was observation and fluid management with supportive care. These are the two authors. The first author was the author of the article, and the second author was giving information about Herxheimer reaction. So I wanted to go through this question answer format just to kind of review this case and get to know Lyme a little better. What is a Herxheimer reaction? In this case, it's a transient reaction to rapid killing of spirochetes leading to an inflammatory response. Now, second question, and these are 9 questions. What were the primary symptoms observed in a newborn case study? This was decreased activity, poor feeding, and abdominal distension. Now, all of these might occur in some children. These only had 3 that stood out to the authors. How was the newborn likely diagnosed with Lyme disease? In this case, it was a recent tick with an erythema migrans rash. There didn't appear to be a congenital transmission in this case from the mother, which can occur. There are very few cases that have been documented, but not every child is going to have a tick bite followed by an erythema migrans rash, but at least it gets this case discussed. Which antibiotic was used to treat the newborn's Lyme disease? In this case, ceftriaxone was used, although in a tick, there are other illnesses like Ehrlichia anaplasmosis that require something like doxycycline. Sometimes there's the discussion of babesia, which requires its own parasite treatment. And there's always a question of Bartonella, where there's treatments for Bartonella that seem to be helpful in Lyme patients. So how soon after starting treatment was this Herxheimer reaction in a newborn? In this case, it was 2 hours, but I don't think it's clear how quickly it occurs in children or adults. Which of the following mediators plays a key role in the inflammatory response of a Herxheimer reaction? In this case, it's tumor necrosis factor alpha and interleukins were suspected. Why can Lyme disease tests be negative in newborns despite an active infection? Neonates did not produce antibodies early in the infection, but also since this was shortly after a tick, there may not have been enough time to detect Lyme disease anyway. Which of the following is an appropriate supportive care measure for managing a newborn with a Herxheimer reaction? In this case, you monitored fluids, provided some fluids to help with the vital signs. I try to avoid steroids in any patient in the face of an infection. Stopping antibiotics immediately has happened. I've seen people of all ages get frightened or concerned with a flare-up of symptoms, and they'll assume it's a side effect of the medicine rather than a release of cytokines. Besides Lyme disease, which of the following infections is also associated with a Herxheimer reaction? In this case, it's syphilis. I have to tell you that Herxheimer reaction seems to occur in people who are not changing antibiotics or starting antibiotics. And so it's, in the English language, a flare-up, an exacerbation is used, but I have patients who have coined the term Herxheimer. Their colleagues have used the word Herxheimer or Herx because the severity of the symptoms is quite difficult to communicate to their friends and colleagues. Now, thank you for joining us for a common sense Lyme disease case presentation. This is my first live presentation on YouTube. If there's any comments or questions, you should let me know in the section below. And I appreciate joining you. I'm going to, before I go, I want to take a look at whether there's any comments. No, I'll follow this with comments later on. So appreciate you joining me. Thank you very much.